Have you ever found yourself utterly exhausted, even after sleeping for 8 hours? Do simple tasks leave you breathless, or does your skin seem paler than usual? These aren't just signs of a busy life, they could be whispers from your body, signaling a condition known as anemia. Anemia is a silent epidemic affecting billions worldwide, subtly eroding energy, focus, and overall quality of life. It's not just about feeling tired, it's about your body struggling to deliver vital oxygen to every cell, organ, and tissue. Today, we're pulling back the curtain on anemia, exploring its most common forms, the unexpected causes, and how you can reclaim your vitality. Prepare to understand one of the most pervasive yet misunderstood health challenges of our time. At its core, anemia is a condition characterized by a deficiency in red blood cells or hemoglobin, the protein in red blood cells that carries oxygen. Imagine your body as a sprawling city, and red blood cells are the delivery trucks, tirelessly transporting life-giving oxygen to every building, your organs, muscles, and brain. When you're anemic, these delivery trucks are either too few, too small, or simply not carrying enough cargo. This leads to an oxygen shortage throughout your body, causing a cascade of symptoms from chronic fatigue to shortness of breath, and even cognitive difficulties. Understanding this fundamental concept is the first step toward grasping the complexities of anemia and its profound impact on daily life. To truly appreciate anemia, we must first understand the marvel that is a healthy red blood cell. These tiny, biconcave discs are produced in your bone marrow, living for about 120 days before being recycled. Each one is packed with hemoglobin, a complex protein rich in iron, which gives blood its characteristic red color. Hemoglobin's unique structure allows it to bind reversibly with oxygen in the lungs and release it efficiently in tissues. This incredible process is essential for everything from generating energy to maintaining body temperature. When this intricate system falters, the body's entire oxygen supply chain is compromised, leading to the myriad symptoms we associate with anemia. The primary symptom of anemia, and often the most debilitating, is fatigue. This isn't just ordinary tiredness, it's a profound, persistent exhaustion that sleep doesn't alleviate. Imagine trying to run a marathon on a quarter tank of gas. That's what your body feels like without adequate oxygen. Other common symptoms include weakness, pale skin, shortness of breath, dizziness, and cold hands and feet. Some people experience headaches, brittle nails, and even pica, a craving for non-food items like ice or dirt. These symptoms are your body's distress signals, indicating that it's struggling to cope with an insufficient oxygen supply, profoundly affecting quality of life and daily productivity. Anemia isn't a single disease, it's an umbrella term for various conditions, each with distinct causes. The most common type, accounting for about half of all cases globally, is iron deficiency anemia. However, other forms include vitamin B12 deficiency anemia, folate deficiency anemia, anemia of chronic disease, aplastic anemia, hemolytic anemias like sickle cell disease and thalassemia, and even anemias caused by sudden blood loss. Each type has its unique underlying mechanisms, requiring different diagnostic approaches and treatment strategies. Understanding these distinctions is crucial for effective management and recovery, moving beyond the misconception that all anemia is simply about iron. Iron deficiency anemia, IDA, is by far the most prevalent form, affecting over 1.6 billion people worldwide, with women and children disproportionately impacted. Iron is a critical component of hemoglobin. Without enough of it, your bone marrow can't produce sufficient healthy red blood cells. Think of iron as the essential building block for your oxygen delivery system. When these blocks are scarce, the delivery trucks, your red blood cells, are built small and inefficient, unable to carry their full oxygen payload. This widespread deficiency stems from various factors, often a combination of inadequate dietary intake, poor absorption, or excessive blood loss. The causes of iron deficiency are multifaceted. Dietary insufficiency is a major culprit, especially in regions where meat consumption is low or nutrient-poor diets are common. Vegetarians and vegans must be particularly mindful of their iron intake. Malabsorption issues, such as those seen in celiac disease or Crohn's disease, prevent the body from properly absorbing iron, even when consumed. Chronic blood loss is another significant factor. For women, heavy menstrual periods are a common cause, while gastrointestinal bleeding from ulcers, polyps, or certain medications can affect anyone. Pregnancy also dramatically increases iron requirements, making supplementation often necessary. Diagnosing iron deficiency anemia typically begins with a complete blood count, CBC. This common blood test measures the number of red blood cells, their size, and the amount of hemoglobin they contain. In IDA, red blood cells are often microcytic, smaller than normal, and hypochromic, paler than normal. Further tests, such as serum ferritin levels, which measure iron stores, and transferrin saturation, which indicates how much iron is circulating in the blood, confirm the diagnosis. These diagnostic steps are crucial not only to identify IDA but also to differentiate it from other types of anemia, ensuring the correct treatment path is chosen from the outset. The cornerstone of treating iron deficiency anemia is iron supplementation. Oral iron supplements, typically ferrous sulfate or ferrous gluconate, are highly effective when taken correctly. However, compliance can be an issue due to potential side effects like constipation, nausea, or stomach upset. It's crucial to take iron on an empty stomach for better absorption, often with vitamin C to enhance uptake, and to avoid taking it with calcium or antacids. In severe cases, or when oral iron isn't absorbed or tolerated, intravenous iron infusions may be necessary. Addressing the underlying cause of the deficiency, such as treating gastrointestinal bleeding or managing heavy periods, is equally vital for long-term success. Beyond iron, vitamin B12 and folate are essential for red blood cell production. These B vitamins are crucial for DNA synthesis within developing red blood cells. Without sufficient amounts, the bone marrow produces abnormally large, immature red blood cells called megaloblasts, leading to megaloblastic anemia. This is often described as macrocytic anemia because the red blood cells are larger than normal. While the cells are big, they are inefficient at carrying oxygen, leading to similar symptoms of fatigue and weakness. Understanding the role of these vitamins highlights that not all anemia is an iron problem, emphasizing the importance of precise diagnosis. Vitamin B12 deficiency is often caused by pernicious anemia, an autoimmune condition where the body attacks intrinsic factor, a protein required for B12 absorption in the small intestine. Other causes include strict vegetarian or vegan diets, malabsorption syndromes like Crohn's disease, or gastric surgeries that remove parts of the stomach producing intrinsic factor. Symptoms can extend beyond general anemia to include neurological issues like tingling, numbness, balance problems, and even cognitive impairment, due to B12's role in nerve health. Diagnosis involves measuring serum B12 levels and sometimes intrinsic factor antibodies, crucial for differentiating it from other anemias. Folate, or vitamin B9, is another critical nutrient. Deficiency is commonly linked to inadequate dietary intake, as folate is found in leafy green vegetables, fruits, and fortified grains. Certain medications, like some anti-seizure drugs, can also interfere with folate absorption. Pregnant women have significantly increased folate requirements to support fetal development, and deficiency can lead to severe birth defects. Unlike B12 deficiency, folate deficiency rarely causes neurological symptoms. Diagnosis involves measuring serum or red blood cell folate levels. Both B12 and folate deficiencies underscore the intricate nutritional requirements for healthy blood production. Treatment for vitamin B12 deficiency typically involves B12 injections, especially in cases of pernicious anemia where oral absorption is impaired. These injections bypass the digestive system, delivering the vitamin directly to the bloodstream. For dietary deficiencies, high-dose oral supplements can be effective. Folate deficiency is usually treated with oral folic acid supplements and dietary changes. In both cases, identifying and addressing the underlying cause is paramount. For instance, if a medication is interfering with absorption, alternative treatments may need to be explored. These treatments can dramatically improve symptoms and prevent long-term complications, restoring both blood health and overall well-being. Anemia of chronic disease, or anemia of inflammation, is a common type that doesn't stem from nutrient deficiency but rather from underlying chronic conditions. It's often seen in people with cancer, kidney disease, autoimmune diseases like rheumatoid arthritis, or chronic infections. The inflammation associated with these conditions interferes with the body's ability to use iron effectively, even if iron stores are normal. It also suppresses red blood cell production in the bone marrow and shortens the lifespan of existing red blood cells. This form of anemia is challenging because treating the anemia often means managing the primary chronic disease itself, highlighting the systemic nature of inflammation. Diagnosing anemia of chronic disease requires careful differentiation from iron deficiency anemia, as both can present with similar symptoms. Typically, patients with anemia of chronic disease will have normal or elevated ferritin levels, indicating sufficient iron stores, but low serum iron and transferrin saturation, indicating iron isn't being properly utilized. The key is the presence of an underlying inflammatory condition. Treatment primarily focuses on managing the chronic disease, which often improves the anemia. In some cases, erythropoiesis-stimulating agents (ESAs) may be used to encourage the bone marrow to produce more red blood cells, offering symptomatic relief. Beyond the more common forms, several rare and severe types of anemia exist, each with unique pathologies. Aplastic anemia, for instance, is a life-threatening condition where the bone marrow fails to produce enough blood cells, red, white, and platelets. This often results from an autoimmune attack on bone marrow stem cells or exposure to toxins, radiation, or certain medications. Patients become highly susceptible to infections, bleeding, and severe anemia. The bone marrow, the very factory of blood, essentially shuts down. This severe form requires intensive medical intervention, often including bone marrow transplantation, highlighting the critical role of a healthy, functioning bone marrow. Hemolytic anemias involve the premature destruction of red blood cells, reducing their lifespan from the typical 120 days to a mere fraction. This destruction can be caused by genetic factors, such as in sickle cell disease or thalassemia, or acquired conditions like autoimmune hemolytic anemia. Sickle cell disease, prevalent in individuals of African, Mediterranean, and South Asian descent, causes red blood cells to deform into a crescent shape, making them rigid and prone to block blood vessels. Thalassemia, common in Mediterranean and Southeast Asian populations, involves defects in hemoglobin synthesis, leading to fragile, short-lived red blood cells. These conditions present significant lifelong challenges. Sickle cell disease leads to chronic pain, organ damage, and an increased risk of infections. Thalassemia can cause severe anemia, bone deformities, and iron overload due to frequent blood transfusions. Treatment for these genetic anemias is highly specialized. Sickle cell management includes pain control, hydration, and medications to prevent crises, with bone marrow transplantation as a potential cure for some. Thalassemia often requires regular blood transfusions and iron chelation therapy to remove excess iron. These lifelong conditions underscore the devastating impact genetic defects can have on blood health, requiring continuous care and significant medical resources. Another form is anemia due to acute or chronic blood loss. While chronic blood loss, like heavy menstrual periods or persistent gastrointestinal bleeding, often leads to iron deficiency anemia over time, acute, severe blood loss from trauma or surgery can cause a sudden and drastic drop in red blood cell count. This immediate reduction in oxygen carrying capacity can be life-threatening, leading to hypovolemic shock. Treatment focuses on stopping the bleeding and replacing lost blood volume, often through blood transfusions. This highlights the body's delicate balance and how quickly a critical component like blood can be lost, demanding immediate medical intervention. Diagnosing anemia always begins with a thorough medical history and physical examination. Your doctor will ask about your diet, medications, family history, and any symptoms you've experienced. A physical exam might reveal pale skin, rapid heart rate, or an enlarged spleen. The cornerstone of diagnosis, however, is blood tests. A complete blood count, CBC, is the first step, providing vital information about the number, size, and hemoglobin content of your red blood cells. Further specialized tests, like iron studies, vitamin B12 and folate levels, or genetic tests, help pinpoint the exact type and underlying cause of the anemia. This systematic approach is critical for effective treatment. Interpreting blood test results can be complex. For example, although hemoglobin level confirms anemia, but the size of your red blood cells, indicated by mean corpuscular volume, MCV, is key. A low MCV suggests microcytic anemia, often iron deficiency. A high MCV points to macrocytic anemia, typically B12 or folate deficiency. Normal MCV with anemia might indicate anemia of chronic disease or blood loss. Further tests, like respiratory count, new red blood cell production, can assess bone marrow activity. These detailed insights from blood work guide clinicians towards the specific type of anemia, ensuring tailored and effective treatment strategies. Preventing anemia, particularly iron and B12/folate deficiency, often comes down to diet. A balanced diet rich in iron-fortified foods, lean meats, poultry, fish, leafy green vegetables, and legumes is crucial. Pairing iron-rich foods with vitamin C sources, like citrus fruits or bell peppers, enhances absorption. For vegetarians and vegans, ensuring adequate intake of plant-based iron, non-heme iron, and B12 fortified foods or supplements is especially important. Regular consumption of foods rich in folate, such as asparagus, Brussels sprouts, and fortified cereals, also plays a vital role in prevention. Small dietary changes can make a significant impact. Dietary supplements can be a valuable tool for preventing and treating certain anemias, but they should always be taken under medical guidance. Oversupplementation, especially with iron, can be dangerous, leading to iron overload, hemochromatosis, which can damage organs. For at-risk groups like pregnant women, regular iron and folic acid supplementation is often recommended. Individuals with malabsorption issues or strict dietary restrictions might require targeted B12 or folate supplements. Always consult a healthcare professional before starting any new supplement regimen to ensure it's appropriate for your specific needs and to avoid potential harm. Lifestyle adjustments can also play a role in managing anemia symptoms and supporting recovery. Prioritizing rest and managing energy levels is crucial. Avoid overexertion and schedule periods of rest throughout the day. Staying hydrated and maintaining a healthy exercise routine, as tolerated, can improve overall well-being. For those with chronic blood loss due to heavy menstrual periods, discussions with a gynecologist about potential treatments like hormonal therapy or other interventions can be beneficial. These holistic approaches, combined with medical treatment, empower individuals to take an active role in their health journey. The long-term consequences of untreated anemia can be severe and far-reaching. Chronic fatigue can impair productivity, concentration, and quality of life. In children, severe iron deficiency can lead to irreversible developmental delays and cognitive deficits, impacting academic performance and future potential. For adults, prolonged anemia can strain the heart, leading to an enlarged heart or even heart failure, as the heart works harder to pump oxygen-depleted blood. Pregnant women with anemia face increased risks of premature birth, low birth weight, and maternal mortality. These grave outcomes underscore the critical importance of early diagnosis and treatment. Certain populations are at higher risk of developing anemia. Women of childbearing age, particularly those with heavy menstrual periods or multiple pregnancies, are highly susceptible to iron deficiency. Infants and young children, especially those with rapid growth spurts or diets lacking iron, are also vulnerable. Vegetarians and vegans, due to the lack of heme iron in their diet, need careful meal planning. Individuals with chronic diseases such as kidney failure, inflammatory bowel disease, or autoimmune conditions often develop anemia of chronic disease. Regular screenings and awareness are particularly important for these at-risk groups. The global burden of anemia is staggering. According to the World Health Organization, anemia affects over 1.62 billion people globally, representing 24.8% of the world population. Iron deficiency anemia alone accounts for about 50% of all anemia cases. The highest prevalence is among preschool children, 47.4%, and pregnant women, 41.8%, especially in developing countries. This widespread prevalence highlights a significant public health challenge with profound social and economic consequences, impacting work productivity, educational attainment, and healthcare costs on a global scale. It's a silent crisis that deserves far more attention. Public health initiatives play a crucial role in combating anemia. Fortification of staple foods like flour, salt, or milk with iron and folic acid has proven highly effective in reducing deficiency rates in many countries. Educational campaigns promoting diverse, nutrient-rich diets and dispelling myths around nutrition are also vital. Supplementation programs for pregnant women and young children are standard practice in many regions. These large-scale interventions demonstrate that with concerted effort, significant strides can be made in reducing the burden of anemia and improving the health outcomes of millions. The future of anemia treatment holds exciting possibilities. Advances in genetic therapies offer hope for inherited anemias like sickle cell disease and thalassemia, with gene editing technologies like CRISPR showing promising early results. Improved iron formulations that are better absorbed and cause fewer side effects are continually being developed. Research into novel erythropoiesis-stimulating agents and anti-inflammatory drugs also aims to provide more targeted and effective treatments for anemia of chronic disease. These innovations promise to transform the landscape of anemia care, offering new hope for those living with these challenging conditions. Understanding your own risk factors is a powerful first step. If you have heavy periods, follow a vegetarian or vegan diet, have a chronic illness, or experience persistent fatigue, discuss these concerns with your doctor. Regular checkups, including blood tests, can help detect anemia early, often before severe symptoms develop. Don't dismiss persistent tiredness or paleness as simply getting older or being stressed. These could be crucial signals your body is sending, indicating a need for medical attention and potentially life-changing interventions. Being proactive about your health is key to preventing complications. Empowering yourself with knowledge about anemia can lead to better health outcomes. By understanding the diverse types, causes, and treatments, you can engage more effectively with your healthcare provider. Ask questions about your diagnosis, treatment options, and how to best manage your condition. Knowledge reduces anxiety and allows for informed decisions regarding diet, supplements, and lifestyle. Remember, you are your own best advocate, and an active role in your health journey is crucial for a successful recovery and long-term well-being. This deeper understanding is not just for medical professionals, but for everyone. Dietary strategies are not just about iron. Ensuring adequate intake of B12 is vital, especially for vegetarians and vegans. Fortified cereals, plant-based milks, and nutritional yeast are excellent sources. For folate, prioritize dark leafy greens, legumes, and citrus fruits. Cooking methods can also impact nutrient retention. For instance, steaming vegetables retains more folate than boiling. Consider using cast iron cookware, which can subtly increase the iron content of food. These small, consistent dietary habits contribute significantly to maintaining healthy blood and preventing deficiencies before they escalate into anemia. The role of the gut microbiome in nutrient absorption is an emerging area of research. A healthy gut is crucial for efficiently absorbing essential vitamins and minerals, including iron, B12, and folate. Dysbiosis, an imbalance in gut bacteria, or conditions like celiac disease or inflammatory bowel disease, can significantly impair nutrient uptake, contributing to anemia. Probiotics and prebiotics may play a supportive role in optimizing gut health, though more research is needed specifically regarding anemia. Maintaining a diverse and healthy gut flora could be another preventative layer against certain forms of anemia, emphasizing the interconnectedness of body systems. For those already diagnosed with anemia, consistent adherence to treatment is paramount. Skipping iron supplements or B12 injections can hinder recovery and prolong symptoms. Regular follow-up appointments with your doctor are essential to monitor your blood counts, adjust dosages, and assess the effectiveness of treatment. Don't hesitate to report any side effects, as alternative medications or delivery methods might be available. Persistence and open communication with your healthcare team are key to successfully resolving anemia and preventing its recurrence, ensuring you regain your strength and vitality over the long term. Beyond just physical symptoms, anemia can profoundly impact mental health. Chronic fatigue and the struggle to perform daily tasks can lead to feelings of frustration, anxiety, and even depression. The constant battle against low energy can diminish motivation and enjoyment of life. Addressing anemia isn't just about restoring physical health, it's also about improving mental well-being. As energy levels improve with treatment, so too often does mood, concentration, and overall outlook. Recognizing this connection allows for a more holistic approach to care, ensuring both body and mind are supported throughout the recovery process. In conclusion, anemia is far more than just feeling tired. It's a complex group of conditions where your body struggles to deliver vital oxygen, impacting every aspect of your life. From the pervasive iron deficiency to the intricacies of B12, folate, and chronic disease anemias, each type demands specific understanding and tailored treatment. The good news is that most anemias are treatable, and many are preventable through informed dietary choices and lifestyle adjustments. By raising awareness, promoting early diagnosis, and adhering to appropriate medical care, we can collectively combat this silent struggle and help millions reclaim their energy, health, and quality of life. Don't let unexplained fatigue or weakness control your life any longer. If you suspect you might be anemic, please consult your healthcare provider. A simple blood test can reveal a world of information and set you on the path to recovery. Your body is constantly communicating with you. It's time to listen to its signals and take proactive steps towards a healthier, more vibrant future. Thank you for joining us on this deep dive into anemia. We hope this information empowers you to better understand your body and advocate for your health. Stay informed, stay healthy.